Now let's go over the exact signs and symptoms of alcohol abuse and the use of prohibited controlled substances. Pay close attention or take notes. When you need to confirm that the behaviors you observe are consistent with the signs of use, these are the items you'll be comparing your observations to. Included with this course is a document which reviews these signs and symptoms. We highly recommend downloading it at the conclusion of the course and keeping a copy available for reference at all times. Signs of alcohol abuse. Alcohol is a central nervous system depressant found in beer, wine, hard liquor, and in some over-the-counter medications. Considered a recreational beverage when consumed in moderation, for enjoyment and relaxation during social gatherings, alcohol is widely abused, primarily due to its social acceptance and availability. Abuse occurs when it is used primarily for its physical and mood-altering effects. When determining reasonable suspicion for alcohol, there are several signs you should look for: slurred speech, bloodshot watery eyes, poor balance, odor of alcohol in the breath, involuntary eye movements. Marijuana alters the brain's interpretation of incoming messages, but does not depress the reactions of the central nervous system. It alters a person's sense of time and reduces the ability to perform tasks requiring concentration, swift reflexes, and coordination. This drug has a significant effect on a user's judgment, caution, and sensory and motor abilities. When determining reasonable suspicion for marijuana, here are the signs you should look for: very bloodshot eyes, muscular tremors or involuntary quivering, impaired time and distance perception, short attention span, disoriented behavior, inability to divide attention. Cocaine is a stimulant drug, also known as blow, Charlie, Coke, Snow, or Zip when it's inhaled, snorted, ingested, or injected. Free-base cocaine, known as base, crack, or rock, is smoked. Cocaine is used medicinally as a local anesthetic. It is abused for its powerful physical and mental stimulant properties. The entire central nervous system is energized by cocaine. The heart rate and blood pressure are elevated. Muscles become more tense and the body burns more energy. The brain experiences an exhilaration caused by a large release of neurohormones associated with the mood elevation. When determining reasonable suspicion for cocaine, there are several signs you should look for: uncontrolled talkativeness, difficulty focusing your eyes, excitable behavior, dilated pupils, sniffles or runny nose, body tremors, teeth grinding, and disordered thinking. Amphetamines and methamphetamines are stimulants. Some common street names for amphetamines are speed, uppers, black beauties, bennies, wake-ups, and dexies. Some common street names for methamphetamines are ice, crank, crystal meth, 64, glass, Christy, Go Fast, Oz's, and in a smokable form, LA glass. Amphetamines and methamphetamines are drugs that stimulate the central nervous system and promote a feeling of alertness and an increase in speech and general physical activity. When determining reasonable suspicion for these, there are several signs you should look for: dilated pupils, distorted thinking, exaggerated reflexes, hallucinations, repetitive bizarre behavior, jaw grinding, anorexia, loss of coordination, and physical collapse. Opiates, including heroin, morphine, codeine, and many other synthetic drugs, are used to alleviate pain and depress the body functions and reactions. In large doses, opiates cause a strong euphoric feeling. Common street names for opiates are horse, morpho, China, H, M, brown sugar, Harry, and dope. Sometimes narcotics found in medicines are abused. This includes pain relievers containing opium and cough syrups containing codeine. Heroin is illegal and cannot be obtained even with a prescription. Most medical problems associated with the use of opiates are caused by uncertain dosages, use of unsterile needles, contamination of the drug, or from combining the narcotic with other drugs. When determining reasonable suspicion for opiates, there are several signs you should look for: constricted pupils, droopy eyelids, dry mouth, low raspy speech, depressed reflexes, and poor coordination. PCP acts as both a depressant and a hallucinogen at the same time, and sometimes as a stimulant. It's also called angel dust, rocket fuel, embalming fluid, and killer weed. PCP was developed as a surgical anesthetic in the late 1950s. Later, due to its unusual side effects in humans, it was restricted to use as a veterinary anesthetic and tranquilizer only. Today it has no lawful use and is no longer legally manufactured. It is abused largely for its variety of mood-altering effects. PCP scrambles the brain's internal stimuli and alters how users see and deal with their environment. Routine activities, like driving or walking, become very difficult. A low dose produces sedation and euphoric mood changes. The mood can change rapidly from sedation to excitement and agitation. Increased doses produce an excited, confused state, including any of the following: muscle rigidity, loss of concentration and memory, visual disturbances, delirium, feelings of isolation, and convulsions. When determining reasonable suspicion for PCP, there are several signs you should look for: impaired driving ability, thick, slurred speech, poor coordination, violent or combative behavior, behavior reoccurring in cycles, involuntary eye movement, confusion or loss of memory, and disorientation to time and environment. Over-the-counter medications and even prescription medications may interfere with the ability to drive safely and perform other tasks effectively. Employees should know about the possible side effects of these medications before they take them. If an employee is using a prescription medication, they should notify you before work begins. Then you can make an appropriate determination of what work functions they can or cannot perform. If they have any questions, they should consult their physician. Find out what the side effects of the medication are, and if other work is available, assign them tasks that will not be affected by the drug use or interrupt the tasks of others. If this is not possible, you may decide to direct the employee to take sick time while on this medication. Follow your company's policies and procedures regarding this.